Hello, I'm Dr. Little, the Forest at Duke Medical Director. As we round out the end of this difficult year, I have much to be thankful for, including this community, the surrounding nature, and my beautiful family. Thanksgiving is my father's favorite holiday, so I always make an effort to be with my extended family to celebrate and share a feast. This year, however, I am making the choice to protect those I love and host a smaller gathering with just my immediate household members. I hope that you might also consider making some changes to your Thanksgiving traditions to protect yourselves, your loved ones, and neighbors during this challenging and frustrating time. The suggestions I am making today are specifically for the independent living residents, as we have a different set of restrictions in place at the health center. I urge those of you living in the health center who may have questions related to Thanksgiving to please direct those to the staff on your unit. For those in independent living, I have 3 recommendations to help you have a safer and happier Thanksgiving. 1, limit the size of your gathering. 2, wear your mask properly throughout the gathering. And 3, have a safety plan in place before your gathering. Limit the size of your gathering. For those of you hosting a Thanksgiving event on campus, please refer to and follow the forest visitation policy that was distributed earlier. As a reminder, you are allowed to host up to 4 visitors at a time in your dwelling. If you leave campus or gather with friends from the forest community, it is recommended that you limit these gatherings to no more than 10 people. The more people that gather together, the more likely you are to come into contact with someone who has COVID-19. The safest gathering is limited to the people in your immediate household. Even people who have been in your social pod since March may be a risk to you, since the rates of community spread have increased at an alarming rate. I suggest that you consider tightening your pod until we get on the other side of this surge. Wear your mask properly throughout your entire Thanksgiving gathering if you will be around anyone outside your immediate household. Please wear a mask even if your gathering is outside and you have plans to remain 6 feet apart. The most effective mask is at least 2 layers and fits snugly but comfortably over your nose, chin, and sides of your face. At the beginning of the pandemic, we didn't have clear evidence of mask effectiveness, and because of that, unfortunately, masking became very political and polarizing. I'm lucky to work at Duke, where several researchers have collaborated with other research institutions to study the effectiveness of masks in preventing the spread of COVID-19. Epidemiologic, as well as laboratory data, have consistently shown that mask wearing can reduce the spread of infectious viral particles between people. Even if it isn't 100% effective, there is also evidence that masks help to reduce the amount of virus that spreads from person to person. So if you do get COVID-19, your body isn't overwhelmed by the amount of virus particles that are present, and you are more likely to have a milder disease course. I am convinced that the use of masks has contributed to the reduction in mortality that we have seen despite the increased spread. Here are a few of my masks that work well for me. I do have to adjust them before putting them on so that they can fit comfortably, but once I get them settled, I can wear them for long periods of time, up to multiple hours. The one I use most commonly because I work in a hospital setting is my surgical mask. If you do have access to a surgical mask, they're probably the most effective. You see, when I put mine on, there is quite a bit of gapping, and it tends to come over my eyes. So to make mine more comfortable, what I do is I make a very small loop in the sides, and I will just do one to demonstrate. But for me, I had to test it several times. But I made one small loop on each side. Then I make sure that the nose piece is comfortable. And then when I put it on, this side fits comfortably. I pinch it around my nose. I make sure to adjust it in place right where it is. And of course, perform my hand hygiene before and after. Other masks that have fit well for me have been my 2-layer fabric mask that has an adjustable piece on the earlobe so that I can get it in place and then make sure that I adjust it in the back so that it fits comfortably. Once again, hand hygiene before and after masking. The last mask was a mask that was made lovingly by a friend of mine. It is homemade, it has 2 layers, and actually has a pocket for some filters that I was able to get. These are shop towels, actually, that were cut, and they can be inserted into the mask to provide even more protection. And this is not quite as adjustable, but I did put in a pipe cleaner, just a simple pipe cleaner, to make it fit comfortably over the nose. And so you see that all of my face is protected. Whenever I'm around people, I make sure to keep my mask snugly over my nose the entire time, because this doesn't protect other people or myself. And certainly leaving it dangling like this or under my chin doesn't provide any protection whatsoever. So those are just a few of my favorite masks that I have personally. Have a safety plan in place before your gathering and share it with everyone who will be attending. Ensuring that everyone at your gathering knows and agrees to your expectations can help avoid uncomfortable conversations during the gathering. Some things to consider that can help make your gathering safer. Since much of the reported spread of COVID-19 has occurred when people are eating together, consider staggering your eating time so that not everyone is unmasked at the same time. Another thing is, instead of serving family-style food or buffet-style food, have pre-portioned plates served by someone wearing a mask and gloves on a recently cleaned surface. Better yet, consider having each person bring their own food, utensils, and plates. Provide single-serving condiments and disposable containers. Set out hand sanitizer in multiple locations and let people know that you expect them to use it often, especially before and after touching their masks. Set up all seating to be at least 6 feet apart so that it is clear for all people at the gathering where they need to sit. If weather permits, have your gathering outside. Even if you do this, you still need to maintain a 6-foot distance and wear a face covering. Avoid hugging, kissing, and shaking hands. This can be particularly difficult if you are visiting or hosting children. Trust me, I know from personal experience because my children are very kissable. So setting this expectation in advance is very important. In the absence of symptoms or an exposure, I do not recommend routine asymptomatic testing before a gathering because the chances of a false negative test are higher and can lead people to have a false sense of security and to disregard the safety practices I just outlined. If you or someone in your gathering recently tested negative, please don't let your guard down and continue to follow the governor's 3W recommendations. Wear a mask, wash your hands, and wait 6 feet apart. Lastly, if you do spend time with people you have not regularly been spending time with, for example, those outside of your pod, we strongly recommend that you self-isolate from the community for a period of 14 days from your initial exposure to a new group. This means that you will keep to yourself, avoid common areas at the forest, and contact the clinic if you develop any symptoms right away. This applies whether you are hosting visitors at the forest or visiting someone off campus. More than anything this Thanksgiving, I hope that you are all able to spend some time reflecting on the things we have in our lives for which we can be grateful. Having a thankful spirit is one way to promote resiliency and health. I am thankful for you and the relationships I have built here so far. Stay well and be safe.